ChatGPT is like practicing medicine with just one sense. Multimodal AI is where it gets its eyes and ears. So what is multimodal AI? These are models that can process more than just text. LLMs like ChatGPT take text as their main input, and more of them are now starting to process other inputs as well, like images. Google Gemini is a great example of a truly multimodal AI. In medicine, LLMs like ChatGPT don't work so well because you're not only relying on your clinical notes to make decisions. Real medicine is what you see, what you hear, and what you measure. Things like the rash pattern, work of breathing, ultrasound clips, CT scans, and then the narrative in the chart is kind of put it all together to explain what's going on. As a clinician, you tie all this multimodal information together to create a coherent model of what's happening to your patient. When some information is missing, you compensate and you adjust your approach to the patient, but your confidence also lowers at the same time. So multimodal AI is a very similar concept. Instead of only ingesting tokens from a note or text, the model can ingest an image, audio, videos, and can relate it to the text. However, the model isn't really seeing the same way that you are as a clinician. It simply converts the pixels and the sound waves into numerical representations and then learns patterns across them. But the key point is the integration of all of these. It can use multiple signals to arrive at a more informed output than just a single stream alone. And for medicine, this matters quite a bit. While LLMs are good for documentation and summarization, multimodal systems truly excel at helping us move closer to triage, screening, and decision support. A big safety issue, though, to remember is that while multimodality will increase your capability, it will also increase the number of potential failure modes. You can get false reassurance from a blurry photo, and the bias in the training data doesn't always represent real-world skin tones, for example, especially if you're a melanated. This is well documented. Plus, if you have multimodal inputs, you also need to be able to determine which stream contributes to which errors, and to ensure that the AI is trained on the right multimodal data set. Follow and save this. Tomorrow we talk about agentic AI and where it can be useful in medicine.